This is CCTA case number 8. The history is that of a 57-year-old man who has persistent chest pain despite a normal, full Bruce protocol treadmill examination that showed no evidence of ischemia. This case is a bit more deceptive than you might understand in the initial view of that. Let's concentrate first of all on the question involving the left anterior descending. Let's start over the origin of the left anterior descending, and we can see that there is, if we rotate about here, clearly non-obstructive, eccentric, calcified plaque involving the proximal LAD. The remainder of the vessel appears to be grossly normal. This is just a single phase for review. Ideally, it would be nice to have some additional phases to review, but this is all we have in this particular case. So we found some non-obstructive calcified plaque in the left anterior descending. Let's take a look at the left main. The left main, you can see here, probably appears to be clearly non-obstructive, but there is some fuzziness or haziness about it. And as we rotate around, there appears to be a possibility of some non-calcified but non-obstructive disease involving that area. If we switch to an MPR view, you can see that this just does not appear to be an obstructive lesion. Switching back to a MIP view, we can see here in the origin of the circumflex, there actually is some eccentric, mixed, non-calcified, as well as probably ulcerated plaque involving the ostium of the left circumflex. This is clearly non-obstructive. We follow the remainder of the vessel down. This otherwise is an unremarkable vessel. Let's switch now to the right coronary artery. The ostium appears to be normal as we rotate around. Get to the mid portion of the right coronary artery. There are a couple areas. There's a little fuzziness or haziness in this area. As we rotate around in that area, we can see that there may be some non-calcified eccentric plaque involving a portion of that vessel. Same thing possibly could be seen down here in the distal portion, although this is less convincing, and again, clearly nothing to suggest obstructive disease. So in summary, this 57-year-old man, in my opinion, has no evidence for obstructive disease, but he does have much more disease than you might anticipate. He has got the calcified non-obstructive disease in the LAD. He's got some non-calcified plaque involving the left main. It does not appear to be obstructive. He's also got mixed non-calcified and ulcerated plaque involving the ostium of the left circumflex, and there is probably some mild non-calcified plaque in the mid portion of the right coronary artery. This patient would need to be treated very aggressively with respect to traditional risk factors.